Hey everybody, so I'm going to talk today in this video blog about when people need traditional sinus surgery versus some of the more minimally invasive procedures we have these days, like the balloon sinuplasty procedure. So when I was in training, which is now almost 10 or more years ago, we mainly did what's called the traditional endoscopic sinus surgery. You may see the abbreviation in my book and in other places, FESS, which stands for Functional Endoscopic Sinus Surgery. So we ENTs call these procedures FESSes because of that. So you may hear me use the term FESS in this video. So why would someone today still need a FESS instead of a balloon sinuplasty for chronic sinusitis or other sinus problems? In my practice, I've adapted my practice a lot for sinus patients, and I'm generally offering balloon sinuplasty in the office as the first line surgical treatment for almost all sinus patients in my practice. And the reason for that is I've been getting great results with it for 7 years now. People are really happy, it works well, and the risk profile and downtime is significantly less than the traditional FESS endoscopic sinus surgery. But I still think the FESS is the proper surgery for some patients. Now, what patients are these? So I would say the biggest group who would benefit specifically from traditional endoscopic sinus surgery over balloon sinuplasty would be patients who have significant amounts of nasal polyps. Now, polyps are basically benign growths within the nose that clog up everything inside of your nose and block things. So the problem with polyps, unless they're quite small and they can just be removed easily in the office, is that a balloon is not going to help get rid of a polyp. They need to be cleaned out and things need to be opened up to allow relief from this problem. So for that reason, patients with more than very minimal polyp disease really need to have the traditional old-fashioned sinus surgery and have things cleaned out in the operating room. The other group that I'm now typically doing traditional sinus surgery for would be patients who have had balloon sinuplasty but have either failed to improve or have had, one out of the sinuses that's just stayed clogged and is just not getting better just with the balloon sinuplasty. And I do find sometimes that, on a CT scan or on exam before someone has a balloon procedure, it's like one of the sinuses just looks worse than the others. It's really clogged, it has pus in it, it's just looking really nasty. And I find that sometimes those really badly infected and inflamed sinuses, they may actually need a more invasive and more intense procedure than just the balloon. So sometimes I still offer balloon sinuplasty for those patients, and a lot of them still get better, but they are at a higher likelihood to not respond well to the balloon. And in that case, we can then move forward with the traditional sinus surgery to open that one specific sinus and get things really opened up there. So at this point, that's probably the main two indications that I use traditional sinus surgery for. Otherwise, the balloon works so well for people, and it doesn't burn any bridges. The risk profile is so low that I really think it's worth trying for most sinus cases over the traditional route. So anyway, I hope this video was helpful for you, and I'll talk to you soon.